Hello everybody, I am Dr. Bhagirath Raghuraman, working as Senior Consultant Cardiologist and Program Director of Heart Transplant at Narayana Health City, Bengaluru. Today we will discuss regarding the topic of heart failure. Basically, heart failure is a condition wherein the heart is unable to pump blood at a rate required for the body's circulatory needs. There are many types of heart failure and there are many conditions that cause heart failure. So first of all, let's look at what are the signs and symptoms of heart failure. So the patient presents to us with a history of breathlessness, swelling of the feet, distension of abdomen, puffiness of face, extreme tiredness, exhaustion, unable to do the daily routine of life. When we look at the evaluation of the patient basically has extensive crepitations, that is fluid buildup in the lungs. There is elevated venous pressure, there is enlargement of the liver due to the edema that builds up in the liver. There is also collection of fluid in the abdomen and there is collection of fluid in the feet. The ways to investigate a patient with heart failure, we start off with a routine ECG. An echocardiogram is a very useful test to diagnose heart failure. Changing gears, you can also add on other tests like a cardiac MRI, which will give us an in-detail assessment of the anatomy of the patient, the overall heart function, the possible causes or pointers which will guide us regarding the direction how to investigate the patient. We do a CT scan of the patient both for the cardiac function as well as the coronary anatomy, and we can do a myocardial perfusion scan which will tell us what is the blood supply and whether this heart failure of the patient is related to a decreased blood supply, what we call as myocardial ischemia. The broad ways in which you can treat heart failure are, first of all, lifestyle modification measures wherein you restrict fluids. The guideline recommendation is 1.2 liters in 24 hours. You also do a salt restricted diet for these patients. Medical management is basically anti-failure medications, which is the broad 4 pillars for the management of heart failure, plus the add-on guideline recommended medical management. Next up, you have device therapy. Here again it is divided into those who have a left bundle branch block on ECG, which we use a device called as a cardiac resynchronization therapy with a defibrillator, CRTD device. And for those who don't have a left bundle branch block, we use an ICD, that is an automated internal cardioverter defibrillator device. This device helps to shock the patient out of dangerous arrhythmias and save the patient's life. The next level of devices include a left ventricular or a right ventricular or a biventricular assist device, which is a mechanical circulatory pump which is fitted into the chamber of failure and has got a battery operated support wherein the battery has to be charged every 10 to 11 hours to keep the machine running. And of course, the ultimate in terms of heart failure management is a cardiac transplantation. Here, after the tests are analyzed, we enlist this patient for a heart transplant surgery, and when a suitable donor is available, this patient undergoes a heart transplant, and we follow up with again a new set of medications and periodic tests to look for rejection and monitor the graft survival.